Hi everyone. Thanks for joining us again on Cam, which changed this month to our cat month. So it's more like fam rather than Cam. So we've been having some excellent talks this month from specialists and cat people, which is really exciting for me because I am a big cat person. I do love dogs, but for me, I'm a cat vet at heart, I feel. And I also have my own arthritic cat where I don't have an arthritic dog. So I'm so excited for this evening's talk. We've got Dr. Sarah Caney here, and she is going to talk to us about arthritis in cats, diagnosing, owner tips on recognizing if your cat's got arthritis. As usual, if you've got any questions as we go through, please pop them down in the comments. You'll also see the comment that's just come up about Facebook stars. So this is a new thing that we're doing. And if you wanted to add a star to your comment, then I will make sure either during the live or afterwards, I'll come back and send you a reply. So it's just a way of supporting Cam through Facebook stars. And then the other thing I just want to mention before I hand over to Sarah to give us a little introduction about herself is about the our website, our new website, where there is the member zone and these courses, which you can sign up for. You can get them even if you're not a member, but they are all free to people in the member zone. So if you do want to sign up to the courses, please check out the website and sign up. Loads of really useful information as always there. So I'm just going to take that off now. So before we get right into the nitty gritty of what we want to talk about, thank you so much, Sarah, for coming on. Would you mind just introducing yourself, what you do, where you work? I'm going to pop a little link already on your website for your website in the comments. But if I can ask you to introduce yourself, please.
Well, it's a pleasure to be here. I'm slightly croaky, so I hope that my voice survives the session. Apologies for any hoarseness. So I am a feline specialist, which means that I did many years ago a diploma in feline medicine and have allowed myself to be classed as a Royal College specialist in feline medicine. And I really enjoy working with what I call sort of first opinion cases, which means the everyday cases coming into normal vet clinics as well as referral cases. For a long time, I was working up in Scotland and living in Scotland. I'm now based in England. And I also have, as well as being employed as a clinician, I have my own business, which is called Vet Professionals. And Vet Professionals has a lot of free to access guides, resources, webinars for cat owners. Also some paid for resources like books, but definitely a big interest in arthritis. And actually, if anyone who's tuned in participated in our survey on feline arthritis last year, I would like to say a very big thank you to you. I'm actually still analysing the data, but I hope to submit it for publication in the next month. And I can definitely share some of the tips and insight we gleaned from our survey, which involved hundreds of cat owners who had experience of caring for cats with arthritis.
Because I mean, it is a big thing. We always talk about on Cam, sort of 80% of dogs will end up with arthritis. Is that the case in cats as well, would you say?
Well, there definitely are some challenges with cats in terms of understand. I mean, if only they could talk, as James Herriot said, very much applies. But we think similarly that probably actually more cats have certainly radiographic X-ray evidence of arthritis. Probably 90% of cats, certainly old cats, have evidence of arthritis on X-ray, and we think that probably at least half of those cats are in actually quite significant discomfort. So it's certainly not something that we should ever think is okay to ignore. If your cat you feel is struggling in any way, it's really important to talk about treatment options.
Yeah. But do you find it's quite difficult to get people to have that conversation and the owners?
Well, I think I mean, cats definitely pose a number of challenges as well. We don't take our cats for walks, although
No.
actually some of us do. I know my dad likes taking the cats for a little walk around the churchyard in the summer, but they're not on a lead. We're not throwing a ball for them. It's much harder to spot that very gradual, typical age-related slowing down, which
Mm,
might be partly due to joint pain. And cats are very, very clever at hiding signs of illness. They're very sensible. You know, if it hurts to jump, they just stop jumping, or they jump
yeah,
a lower height. They change their habits, they change their lifestyle to accommodate with that discomfort. And that makes it much harder for an owner to spot. Sometimes you have to sort of, I think, stand back a little bit and think, what was my cat like when they were a 5-year-old? Did
mm,
they like going upstairs? You know, if they're not going upstairs anymore, maybe it's because it's just too much hard work, and that might be because of arthritis. There might be other reasons as well.
yeah,
But because these changes happen gradually, because multiple legs are involved, so cats aren't typically holding a paw up
mm,
and lame, all these things just make it harder for owners and also for vets to spot as well.
yeah. I mean, one of the things I think, I don't know if this is
Mhm.
true, but because they're so light generally as well, it's not as noticeable as like a 30-kilo Labrador that's going to feel that ache quite early on and show some signs, and they just kind of scamper around still with no problems. And I feel like their weight doesn't do them any favors with that, with showing signs.
I think when I was actually an undergraduate, we were actually taught that as well, as in
Mm,
that we were taught almost to ignore the radiographic signs of arthritis
really?
yeah, I mean, because people thought, well, actually the cats aren't showing signs of pain. Therefore, it probably, this is a normal age-related change, which doesn't matter. But the
Mm,
reality we did discover soon after that was actually just they show their pain in different ways. But I'm sure you're right. And cats are very nimble and agile when they're
mm,
healthy, much more gymnastically, athletically impressive than the average dog. Sorry,
yeah.
sorry, dogs. So that probably means there's a lot of, you can lose a lot of that agility and flexibility and still look okay, which
Mm,
might again prevent an owner from maybe spotting signs that their cat has got mobility problems.
yeah. And where do you start the conversation? If so somebody comes into your practice, an older cat or any age, but normally the older ones, and you're maybe thinking, should we be talking about this? Could this cat have arthritis? What sort of things do you start talking about? Just behavior changes?
Yes. So I would say certainly definitely focusing on the older cats, but also there is some data now that, of course, as you would expect, if your cat has had injuries in the
Mm,
past, that too is likely to bring the arthritis at an earlier age. So if you have, a young cat and it has some sort of injury, don't be surprised if arthritis develops maybe when that cat's 3, 4, 5, 6. So
mm,
it's not just the old cats, but certainly particularly the cats 11 and over. What I typically do is try and ask questions about the cat's behavior and lifestyle in terms of, for example, their ability and their enthusiasm,
yeah.
and the ease with which they do certain things. And the things that seem to be most sensitive at identifying joint problems in cats are things like
Mm,
jumping up and jumping down. So is the cat only jumping a smaller distance now? If it's jumping down, does it hesitate? Does it sort of slide down rather than actually jumping? Going up and down steps and stairs is another very helpful thing to ask about. So, if you live in a house that has any steps or stairs, how does your cat find it easy to go up and down those stairs, or do they bunny hop coming down,
mm,
or again hesitate, take it very slowly, stop for rests? Are they still playing? Do they run or chase at all? And then it's really behavior changes that potentially are indicative of pain. So things like, is the cat any grumpier than it used to be? Does it not like it when you pick it up in certain ways or touch it in certain ways? Is it grooming properly? Because of course grooming is a very normal cat behavior, but if it's painful turning around or grooming over certain sore points, we often see particularly cats struggle with the back end of their body. And so if the coat's starting to look a bit tatty there, that can be a clue too. So it's all these little pieces of the puzzle.
Yeah, and I don't know if it works the other way as well, that they will overgroom some areas that are more painful. I had a cat the other week
Yes.
that just developed this bald spot, and it wasn't where I would expect it to have been, just as a normal over grooming spot. And I felt like, kind of around the middle of the spine. And I thought maybe this is a pain related. It's trying to tell us this is where it's
Yes.
hurting.
Yes, absolutely. I think so. Yeah, and I think because pain is so hard in cats to identify, but also bear in mind that if the pain is significant and if more than one leg is involved, it might manifest as the cat that stops really eating as much as it should.
Yeah.
Just because it's so sore, it's not
Yes.
going to go to the food bowl. It's not going to perhaps eat as much. So weight loss and other seemingly unrelated signs might be seen. Having toileting accidents in the house would be another typical one. The cat that previously was fine going through the cat flap, now that's very painful, or even just moving is so painful. Even if there is a litter box, they're not getting there in time.
Yeah. Yeah. So Christine's actually written that here about what about the eating and drinking posture. So exactly that. Maybe they can't stay in that position for a period of time, which is so uncomfortable. They end up not eating so much.
Yes, and I think the way that we typically offer food and water to our cats is at floor level.
Yes.
And if you have got arthritis affecting the spine in your neck and your shoulders and your elbows, and you're crouching down to eat, that can be quite uncomfortable. So we certainly often make a recommendation with cats with arthritis that a tip that can help is to put the food or water bowl on a raised surface.
Yeah.
Which could be just, an ice cream tub turned upside down,
Yeah.
or it could be something a bit posher. And sometimes you will see that the cat just eats much more just because it's so much more comfortable in that position.
Yeah, definitely. That's what I do for, I was saying, I have this 20-year-old with arthritis, and I just used like a box that the cat sachets come in and turned it on its side. And then I've just got like this little foam mat that it all sits on so that he can just comfortably, and he still looks uncomfortable, but definitely he eats better having it just at that head height. Much, much better. The other thing I think in multi-pet households, like cats and dog household, a lot of people will feed the cat on the side, won't they? So the dog can't get to it.
Yes.
What do you
Yeah.
suggest with those kind of situations?
So, yes, I think sometimes cats are very good at training us. And a way that they might do this, which you might not even realize at the time, is that in those situations where the normal feeding place is high up, what you might find is that the cat is not jumping straight onto that surface anymore, but it jumps onto the chair that's beside the work surface and then onto the work surface. And that can be a solution as well that works fine. But part of the reason for mentioning it is also just have your eyes open really for that possibility. Is your cat sort of cheating with its jumps? Is it getting a little bit of extra help?
Yeah.
Yeah, certainly if even jumping on those surfaces is difficult, then you need to find another way of feeding the cat. And it might be that you have to feed the cat in a separate room or invest in a microchip feeder that is not going to open for the dog and will just open for that cat and allow it to get its food, all those sorts of things.
Yeah. And I think it is useful to think, because like you say, sometimes the cat will come in a bit of weight loss, and then when you put all the bits of the puzzle together, it's because it's struggling to get up on the side, and you wouldn't think it because you've done it for 15 years. You just wouldn't think that that's not what it wants to do anymore.
Yes. And the other example would be really busy households. So where perhaps there's lots of cats or other animals, and maybe it's not so much that the dogs are stealing the food, but maybe other cats are, because this cat is not quick enough to get to the food bowl in time, and other cats in the home are hoovering up and it's being pushed out.
Yes. Yeah. And I think the other thing you just said there was about going through the cat flap as well. And so things like struggling or not doing it as quickly or maybe getting itself caught on the way in or out. Again, I put my hands up. I don't really watch my cats go through the cat flap. I hear it. I know it's being used, but you have to look for these things, don't you? You can't just, they're not always very obvious.
Yes, I agree. And I think also it's trying to look at them, also thinking about your cat as maybe a 5-year-old. You know,
Yeah.
how easy is it compared to then? And of course, you know, we can't expect a 20-year-old to move like a 5-year-old. But if we do see, you know, that we can see a range of things, and it alerts us that, as your own cat, that, you know, there are things that we can do to help and support it.
Yeah. Yeah. Just a quick question here from Claire. It says, am I right in thinking cats will not display lameness with arthritis? Kind of mentioned this just early on. Would you say that's always true?
No, I think often it is the case that they're not lame, and that's usually because the most common form of arthritis that we see in our cats is the old cat with you know, degenerative changes in multiple joints. And so because multiple joints and multiple legs are involved, rather than seeing lameness, we quite often will see a stiff gait. So the cat may be taking smaller steps and look a bit less comfortable, but not actively lame. However, we definitely do see some cats with lameness due to arthritis, and that can be just because they're unlucky that, you know, one leg is more severely affected, or it might be because that arthritis related to an injury in a younger cat on that particular leg. So it's not a never, but it's more often than not that they're not. They're either not lame, or you might look at them thinking, oh, their gait is not normal, but I can't work out which is the bad leg. And if that's the situation, that would be typical for a cat with arthritis and multiple joints.
So you've got to look a little bit harder than you would maybe in a dog where it can be slightly more obvious. And if you have an owner that comes in and, like I say, for a normal appointment, not necessarily for a pain consultation, what do you ask them to do? What do you send them away and say, make some notes or look for this?
So I usually I try with all my senior cats, so that's cats 11 years old and over, to incorporate what I would call mobility questions into the history. The first time I see that cat, or for any of its routine appointments. Obviously, if the cat's coming because it's really, really ill, then now might not be the time to take that discussion, but where possible. And so I would ask all those questions about going up and down the stairs and jumping, and does the cat go outside, use the cat flap, etc. I also am a big fan of questionnaires. I find them very helpful. So I have adapted one which is really based largely around the Feline Musculoskeletal Pain Index, the FMPI, which is a questionnaire developed by Duncan Lascelles, he's probably known to lots of Cam.
He's been on Cam. He's been on Cam. Yeah.
Wonderful, Duncan.
Yeah.
So his questionnaire is really helpful because it asks questions about these. There are 17 questions in the long version, things like steps, stairs, and the jumping, and people can grade it, and so you can actually come up with a score of how impaired or otherwise the cat is. And so that's something that quite often at the end of a consultation, if there is a suggestion that maybe mobility problems are in there, I often will email that questionnaire over to the client and say, can they possibly fill that in, because it gives a snapshot then of where things are. But I think more importantly as well, the very nature of the questions actually informs owners what to look out for. And more, I would say there are other similar questionnaires, but also some of the companies that produce painkillers for cats with arthritis have also good resources and checklists. Again, Duncan's got a website, Pain Free Cats. I think it might be .org. Should have sent that to you in advance as well.
I'll have a look for it.
That's got some nice graphics of, for example, the cat that is normal jumping from the ground to a high surface versus the arthritic cat having to jump via the chair and then onto the higher surface. So all those sort of resources are useful as a prompt and useful to teach people really what to look out for. And that gives you a starting point really for discussions.
And Nicola's just written, do you have a copy of the questionnaire on the website? Or is it something you would send?
I have versions of it that are probably not open access because but the FMPI you can find on
I will
all of
put
the
that on.
Duncan Lascelles things. So that's probably the best resource. On my website, in the free downloads section, which
Yes.
is where all
And
the sort of free to access stuff is,
put that
there
on
is a
now.
senior cat questionnaire which does cover all those similar things, and that's what I was using up until quite recently when I started to score it a bit more. But that one is there and free to access and hopefully helpful for you.
Yes, thank you. So I've just put a link. I think it's that one. Yeah, Nicola's just said thank you. So if you go onto the website anyway, there's lots of information on there. And then there's also I'm going to put this link now before I forget, but your book as well, Caring for the Elderly Cat, that's on there, isn't it? It can
Thank you. Yeah, so
purchase on there.
that's a book that was written with myself and Vicky Halls, who probably many of you will know. Vicky Halls is a feline behaviourist, best-selling author of cat books, and we wrote this as I think, quite a celebratory manual, really, of caring for old cats, what we can do to support them in terms of what we might call maintenance. So, their coat, their grooming, their quality of life, but also important health conditions such as arthritis as well are covered in that. And again, you can read more about that on the website.
Yeah, so I've put all those links there and I will put them on afterwards as well. So once you've had that kind of chat and gone through that questionnaire, what would be your next steps about going through diagnosing?
So the steps for diagnosis, I think, firstly, the history, which we've just talked about, so that information gathering from the owner is really important. I think where at all possible, it's also really helpful, and I know you do this for dogs, but to actually see the animal moving. And for cats, because of the challenges in the clinic, actually owners collecting videos can be really helpful. So trying again to have a video where you can see the cat. How does it go up and down stairs? How does it jump? And as a vet, we're quite we've seen a lot of arthritic animals, so I guess our eyes are quite tuned to seeing those problems.
Yeah.
But I think even owners, when you've taken a video and you can look at it again and again, you will see the clues as well yourself. So those mobility videos are really helpful. In the consulting room, it also is helpful if you can see the cat move around. Often cats are quite inhibited at the vets, and so it's not always easy. And also, that anxiety might just turn them into a little bit of a frozen statue. As we were talking on before we came live, Nikki and I were talking, a clinic that I was working with until recently actually built some steps into the side of the clinic wall so we could do some mobility assessments. And I don't know if it is easy for you to just...
I'm going to try and share it. And see.
Share a video or two.
Screen.
So these steps were built into the side of the wall of the consulting room, next to the worktop where the cats were weighed. Thank you. And so this is Boudica, who's really quite severely impaired. And I think because what you can see is she's quite enthusiastic, but she does give up before she reaches the bottom. But also coming down, she did make it look very difficult.
Yes.
And so
just that,
the sort of hesitation, definitely not a fluid gait, a bit of a bunny hop there. And then it's like she's thinking and decided, no, actually, that's enough. Not going to do that.
She even looks sore around her neck. She just looks so tense everywhere.
She does. Yeah, she does. Absolutely.
So I go to...
Yeah, find another one. So the steps, I mean, we generally didn't get cats going up the steps. Occasionally we would. But mainly it was just them coming down.
I think this one is
the one going up.
I would just love to have steps in the consult room. I just think they're just brilliant. Although people would come in and put the cat carrier on them, I would imagine, thinking it was for the...
Yeah, well, they are quite handy, and toddlers sit on them. People put their handbags on them. There's multi-usefulness of them. I think for me, actually, the main utility is really just opening up the dialogue about
Mm.
arthritis and mobility issues, because otherwise it's quite an easy area to neglect in the consulting room, mainly because, again, we're not seeing our patients, unlike the dogs. We don't see them walk through
Mm.
the door, walk around the room. They are just,
No.
sitting in their carriers, often a bit anxiously. So the steps definitely help to get the topic under discussion.
Yeah, yeah, and if they will do that, I mean, because cats do like to be up high, don't they? But in the consult room, they'll go for the smallest corner or the lowest bit of the table
Yes.
to get underneath it.
Yeah, which is, I think, why coming down the steps often works well. And if they're reluctant to come down the steps, then putting the carrier at the bottom,
Yes,
little bit of a temptation that the carrier that they hated coming in suddenly becomes the route home.
yeah, their favorite thing in the world. So once you've been through that,
So then the next step really is obviously to examine the patient,
mm,
and a general physical examination is really important, as well as thinking of arthritis in particular. But from an arthritis perspective, the sorts of clues we're looking for are obviously with the joints themselves. Is there any thickening or
mm,
swelling or obvious discomfort or reduced mobility? Again, because cats often are a bit sort of reticent about being handled. It's not always easy,
mm,
but certainly also if I do detect discomfort, I don't push it, because I really don't. If I've got enough other data from the
yes,
rest of the history,
yeah,
I don't really feel I need to. And because
mm,
it can be unreliable, just because the poor cats are stressed and
mm,
upset. But obviously those joint findings can be helpful. And then other clues, looking at the nails, for example. So are the cats actually shedding their nails, using their nails, or are they very thickened and overgrown?
mm,
And sadly, quite often we see those very thick and overgrown nails actually can grow around and into the
yeah,
pads,
yeah,
and can be difficult to spot at home. So
yes,
that's always really important as a vet to look for that, because of course then if you've got that as well as arthritis, you can't walk without
no,
agony.
no,
Um, and then the poor coat, all those sorts of things as well, evidence of the poor grooming. And I think it's somewhat the temperament as well, the behaviour of the cat in the consulting room. You can, again, stress overlaps with this in general, but the cat that's very guarded, really doesn't
mm,
want to be handled, those are all clues as well that, this cat may be one that has significant issues.
yeah. And how many of those cats would you then proceed to do things like X-rays or potentially CT scans? I suppose if you couldn't see very much, but you wanted to do more.
So I think for me, I would say I'm very much pragmatic about the diagnosis, in that
Mm,
um, I suppose we probably don't have an overall, I'm going to use terrible terminology I don't like, but gold standard for
yeah.
diagnosis of arthritis in cats, because actually we know that whilst x-rays, radiography, certainly can show issues, and in the past we might have viewed that as, well, if I
Mm,
want a diagnosis I need an x-ray, we do know, thanks to excellent work done by people like Duncan Lascelles and others, that actually that's not the case. Joints that seem painful when you examine them don't always
mm,
have radiographic evidence of arthritis, and also vice versa. Joints that have arthritis on an X-ray might not seem to be painful on examination. So there's not a
yeah.
good correlation. And of course, to take an X-ray, multiple X-rays,
Mm,
does require the cat to be sedated,
yeah.
and also is quite considerable expense in terms of
Yeah.
multiple views.
Mm,
Similarly, CT scan, obviously fabulous doing CT scans when we need them, but very expensive.
yeah.
Um, and I would imagine also, although this I don't think is published so far with cats, that there probably isn't a complete agreement even between a
Hmm.
CT scan and clinical findings. So for me, I would not personally, generally, just do radiography for the sole purpose of diagnosing
Yeah.
arthritis
Can
in a
get
cat.
enough.
Yeah.
Yeah.
So what I do is that if I have an older cat that has health issues, where I want to take some x-rays for those health issues, then I quite often will be, I guess, slightly naughty on a radiography perspective, but I will include some joints in the periphery of those films, just really so I
Okay.
can also take the opportunity. I wanted to
Yes.
x-ray this cat's chest and abdomen, but let's include its stifles, its hips, and its
Yeah.
shoulders and its elbows. So we often you will see clues there, and again, it's just file away for this might be useful for the future, or some
Yeah.
useful corroborative evidence now.
Mm.
But I think it's difficult to justify doing x-rays or CT in a cat with sort of multiple limb arthritis, your typical older cat, where I think the history and the physical exam generally give you enough justification to move on to some therapeutic
Treatment.
options.
Yeah, and it's this is the thing, is if the radiographs are going to change your treatment plan, then they're worth doing, aren't they? But actually, if it's not, then yeah, probably not in the best interest of anyone to do them.
Yeah, this is the story I have, and it's, yeah, I mean, it is, sedation is, there is always a risk,
Yeah.
and financially, it's potentially hundreds of pounds later,
Yeah.
and like you say, often it's probably not going to change ultimately what you would do. I mean,
Mm.
for a cat that you think is in significant discomfort, a painkiller trial,
Yes.
it is a sensible thing to do. Whether or not you've pinpointed the diagnosis perfectly, I think.
Mm. Mm. So what about in those cats that present maybe with weight loss, and you're thinking, well, how much of this you can feel on the cat that they've lost a lot of condition and like muscle over their limbs? Is that something you talk about? Say, yeah, it has lost weight, but this weight loss may be just down to that muscle loss and nothing else.
So my preference in a cat that has lost weight would be, where possible, to do some blood work and urinalysis to make sure that we understand as much as we can about general
Mm.
health status, and look for the common causes of weight loss in an older cat simultaneously, which would be things like chronic kidney disease,
Yeah.
hypothyroidism, diabetes, for example. And
Mm.
part of the rationale for doing that, even in the context of our discussions tonight, is that, for example, some of those diagnoses, chronic kidney disease, might have an impact on how we would treat that cat's arthritis as well,
Yeah.
because
Yeah.
we may have, some increased concerns over some of the painkillers and their safety and tolerability, can't speak,
Yeah.
in a cat with kidney disease. So I would always, where at all possible, want to explore those. And also because, often old cats have more than one issue as well.
Yes. Yes.
But at least if we've checked everything, we can say, well, it's good to know that we're not having to worry about A, B, C, D at the
Yeah.
moment.
Yeah.
And also that we've got a good degree of reassurance that they can tolerate whatever painkiller we want to throw at them, and then we can move on
Yeah.
to that.
Yeah. And often basic blood tests aren't horrendously expensive, just to help you to make those decisions. And it's definitely worth doing, isn't it?
Yes,
Rather
and
than
I mean, I
extras,
think
go
at the
for the blood.
very, very minimum as well, if if funds are very limited, which I do totally understand, but actually a urinalysis, a home collected sample of
Mm.
urine. So a lot of older cats will actually pee in either an empty litter tray or one containing non-absorbent cat litter,
Yeah.
and checking the urine concentration, checking for presence of sugar with diabetes, is actually one of the cheapest things we can
Yeah.
do.
Yeah.
And if we find the urine is well concentrated, it probably means the kidneys are likely to be okay. So even
Yeah.
that, as a minimum, it gives me reassurance.
Mm. And it's also good to have as a baseline, isn't it? Because then
Yeah.
when you start treatments, it might be something you wanted to check on a regular basis, just so that you know what it was in the first place. Just a little question that I was going to ask, actually, that Nikita's put here. For cats, is there a predominant area for OA, like the limbs, more so than the axial skeleton, or is it more sort of patient dependent? Are there factors that influence the distribution of OA?
So great questions there. I would say, yeah, there are certain joints that are frequently involved in cats. So elbows, knees, hips, and all the sort of little joints in the lower limbs are quite frequently affected. The spine definitely can be, so we can see the sort of spondylosis, but probably I think less frequently than dogs, although I don't see any dogs, so I don't have the authority. Nikki will have more authority to make that sort of comment.
Yeah,
But
no, I would agree. Yeah, it's
that's my
yeah.
understanding. Certainly when you look at radiographs from cats, you do sometimes see spinal changes, but less typically, I think, than with dogs. I'm trying to remember the rest of the question. Sorry, it is on this.
Sorry.
That's right.
I'll put it back
And
up.
factors that influence that. Well, I would say an important factor would be the breed of the cat, because we do know there are some breed associated issues. So, for example, Maine Coon cats, hip dysplasia and patella problems can make arthritis more likely for those patients in their knees and their hips. So that might be a factor. And also, of course, injuries, as we've mentioned as well, be the main other thing. Thank you.
Yeah. Do you think there's too much of a difference between indoor and outdoor cats? Do you feel that you see more OA in outdoor cats?
Excuse me. I think that certainly there was an interesting paper that came from what's called the Bristol Cat Study, which is so in Bristol they recruited pet owners who got kittens to participate in longitudinal questionnaire studies, and they published a year or two ago the data from the 6-year-old cats. So this whole cohort of kittens are now probably 8 or 9, but they published this data of the 6-year-olds, and they actually found that I think it was about a third of them had some mobility issues, and it was much more likely if they were outdoor cats. Free roaming cats that were not neutered when they were 6 months of age, so perhaps neutered a bit older, and had some previous trauma. And so the previous trauma is probably the biggest influence. The other thing that impacted on it was that cats that were overweight were more likely to have mobility problems. So, of course, you can have a bad joint, but if you're overweight as well, then that's going to make it even more painful.
Yeah, which is our biggest thing that we talk about in dogs as well, is, you know, the overweight dogs. And that's the biggest thing you can do to help with the pain is to get that weight back down. So,
which is very difficult.
Makes sense.
Of course, yeah. And I think the main message with cat, I'm sure it's the same with dogs, but is just to not get there in the first place, because it's so
hard to shift
diet a cat.
And Bonnie's written there, is it more prevalent in males or females?
That is a great question. I haven't seen anything, or I don't remember seeing anything that particularly highlighted males versus females. So my brain is whirring now and thinking, is there anything out there? But I don't think so. But again, I guess with the male cats, if they were more likely to roam and weren't neutered, I think that would have an impact on those things. But if they're all neutered at the same age, then maybe not.
Right. Yeah. And then Bonnie was also written, we sort of briefly did study as well, for cats grooming the same spot quite often, but not removing fur. Could that be a sign of arthritis? Yeah, definitely.
I think so. Yes. Yeah. And similarly for other health issues as well, if your cat's sort of over grooming its tummy, particularly the bottom part of the tummy, that can be a sign of bladder pain. So cystitis, cats sometimes will do that. It's just, you know, this is a sore place and I'm trying to take the pain away. And so, yes.
Yeah, I love that they're screaming that this is, you know, I'm in pain here, and we just go, oh, they're over grooming. It's fine, just one of those things. I don't know about this question. Sorry.
Oh, the Montreal, yeah. So I will confess as well that as a clinician, I have not personally been involved in development of what they call these clinical metrology instruments, which are these questions. But I do think the Montreal one is very, very respected. I have always been a great fan of Duncan's. He was actually the year above me at vet school, so I've known him for a long time as well. Yes, another Bristol graduate. And I followed his work with interest. So that's really mainly why I've gone down that path. And he would be the perfect person to sort of really discuss the pros and cons. But whilst I've read about the Montreal instrument, I've personally not used it. I've used the FMPI for my cats.
Yeah, I will. I'll put that link. I'll find it and put it on. Can we talk a little bit about treatment options then? About where you start with those after you've done bloods, maybe, or the urine analysis.
Yes. So I think, again, probably similar to dogs in lots of ways. There's just a whole range of things that you can do. And I think for the individual animal, different things can have a different impact. And so it's worth looking at as many of these different areas as you can, which start with the environment. So what can I do to, or this is the way I talk about it with my cat owners really, what can I do that makes my house or the cat's house more disabled cat friendly, basically.
Yeah.
So if it has got stairs in it, well, are there all of the resources that the cat needs upstairs and downstairs? And the resources are obviously things like food, water, litter box, somewhere to sleep, somewhere to hide, toys, all those sorts of things. So it's making sure that they don't it's not a struggle to get to the food or the water bowl or the litter box. Litter box is also really important, actually, just to offer them to cats with arthritis, even if that cat still likes going into the garden and that's its first choice.
Yeah.
I would say all cats aged 11 and over, I think even if they've been predominantly outdoor cats, they should have a litter box available. It's up to them as to whether they want to use it, but I would offer it. And because often what you find is that when you offer it, they start using it and they say, thank you so much. This
I
is so
didn't
much
want to go
easier.
out.
I
Yeah.
didn't really want to go. Life was punishing and now you've helped
Yeah.
me. And the ideal litter box for a cat, particularly with arthritis, is something that's easy to step in and out. So has a low access point or is low in. So sometimes at center and getting like a big seed tray can be better than the litter boxes available in the pet shops, because for some reason I don't fully understand, but in a lot of the pet shop ones, if you want a large litter box, which you generally also do because cats
Yeah.
need space, deeper as well, which really annoys me. So the small litter trays, have like that
Yes,
size, and the
they
big
are.
ones are that size, which
Yeah,
is
yeah.
just a bit mad. And ideally the litter box should be in length at least 1.5 times the length of your cat, and that's
Okay.
measuring it from its nose to the base of its tail. So not the flappy bit of the tail, but basically
Yeah.
the cat's head and its body. The litter box should be 1.5 times that length as a minimum. So if you have got a Maine Coon, it really does need a big litter box and
Yeah.
something that it can step in and step out. And the next thing is having litter in it that is not uncomfortable for the cat to stand on. So the sort of wood pellets, the paper pellets, they're fine for younger cats, but actually if you've got a bit of arthritis, you don't want that sort of slightly jaggedy, unstable
Uneven.
surface.
Yeah.
And the ideal litter, from the cat's perspective, is something that looks as close as possible to sand. So a fine sandy consistency clumping cat litter is always what I would advise. And that is doubly good for your arthritis cat because it's soft and comfortable to stand on and dig a hole in, but also because it's clumping, it's really easy to keep clean as an
Yeah.
owner. And also, added bonus for vets is that then when your vet, like me, says, do you know how many times a day your cat wheezes or poos? You can actually answer that question, because so many health issues in older cats are associated with an increased thirst or urination.
Yeah.
And so these things are really helpful. And I much prefer them to, in terms of those sorts of litters, to the litters that are any litter that looks like it was designed for the owner is not
Right.
designed for the cat. And so an
Yeah.
example of that is those very sort of perfumed,
Oh,
absorbent
yeah.
litters where you put it in your litter tray and it says just empty, scoop out the poos, but the
Mm.
wee, you can just leave it there. And then at the end of the week, you throw it all away or whatever. That was not designed with the cat in mind. It was designed
No.
with convenience and the owner in mind. And generally cats don't like that as much. They might tolerate it And if they do,
Yeah.
that's fine. But again, if you're starting from scratch, I would say go for that fine sandy litter.
Mm.
You can tell I'm
And
a
should
bit
we
obsessed
also
with
be
litter.
thinking,
Sorry.
no, well, another thing is, should we be thinking about where we put the litter tray? Because it probably needs to have access from both sides, or at least to the ends anyway, doesn't it? Because they may not want to back out of it. They might want to only walk forwards.
Yes, yes. And so it's lots of things to think about here as well. And again, it can be, logistically challenging depending on your house,
Mm.
but ideally somewhere calm and quiet and relatively private. I mean, because cats
Yeah.
are like us, they sort of do want their privacy. So not
Yeah.
by the washing machine, where the spin cycle is going to probably be a bit alarming. Not in a thoroughfare where there's people
No.
and other cats or animals going past. So somewhere quiet and calm. But yes, if they can, walk through it rather than
Mm.
having to turn around or rearrange themselves, definitely. And just that easy being in and out. And if your home has perhaps different levels and nooks and crannies, having litter boxes, if you can, in each of those areas,
Yeah.
just give your cat the choice if you can.
Yeah. And so those covered ones, that's something I talk about with arthritic cats, is maybe they don't want to, because it's kind of like going through a cat flap, isn't it? To get into a very small area
Yes,
that you've then got to shift. So take the cover off. You don't need to buy a new litter tray, just take the cover
I
off,
would
don't
say,
you?
yeah,
And let the cat.
generally cats generally prefer not covered as
Yeah.
well. So, yeah, I think again, well-intentioned designs by the people that make these things, but actually the cats,
Put the
they don't
owner
want
off.
litter tray liners, they don't want covers, they don't want little
Mm.
flaps. They just want, somewhere that is appealing to them and it's nice and clean.
Yeah.
So
That
that,
makes
yes,
sense.
we've sort of like gone down a bit of a obsessional view of
Litter
litter
tray.
boxes, but that's important. And then the other sort of environmental things for the cat, thinking the arthritis are, think about, where did your cat like sleeping in the past? Did it love
Mm.
sleeping on the bed? If it stopped sleeping on the bed, that might be because it's painful. Can we either make a new bed that looks similar but is at floor level, which
Mm.
might be so like a pillow just with a fleecy blanket on it that the cat can just walk onto the pillow and it feels like a duvet, and it can,
Yeah.
and even squish to a radiator, or you can put your plug-in electric, what am I thinking of? Like electric blankets, those heat pads that you
Yes.
can leave on.
Yes.
You can put that on the blanket, so if your cat's got a cozy walk on,
Mm.
walk off bed. Or can you put like a little chair or something by the side of your bed, and the cat can jump on that chair and get onto the bed? Or
Mm.
steps, you can buy steps for dogs. They often, I actually don't know how much dogs like them, but the adverts on Amazon, they always have like a cavalier or something next to these
Yes.
steps that you can put next to your bed. You can
Yeah.
you can use those for cats as well. You sometimes need a little bit of training with, dreamies and things to
Mm.
encourage them to give it a go.
Yeah.
So really trying to make whatever things they like as accessible and easy and supported as possible. Lifting up the food and water bowls, we talked about
Mm.
that as well. So those are all the sort of environmental things that are definitely a good starting point. And then beyond there, for me, mainly it's about painkillers. I mean, there are
Yeah.
other therapies that people use, and for which sadly there's not much published. The main sort of data that we've got evidence for is really painkillers, so things like the
Mm.
non-steroidals, and more recently the monoclonal anti-nerve growth factor Silencia
Yeah.
treatments.
Yeah, which is what I personally use, because I think it's lovely, because if you do have cats where they've got gastric issues, or kind of the same with dogs, or kidney issues or whatever, and you don't want to use those non-steroidals, we now have this other brilliant option that works normally in a lot of cats, works really, really well. But
Yes, and
sometimes
I
you,
think
you need a
it's
combination.
yes, absolutely. And I think if you're wanting to test out really how much of a difference pain relief is going to make,
Mm.
then still it can be probably more straightforward to use the non-steroidals, because you usually will see very quickly the impact.
Yeah.
The monoclonal antibody treatment is a monthly injection, which is great in terms of at home you don't have to worry so much about.
No.
But it's I guess there are swings and roundabouts, but the two together often are actually for severe cases very helpful as well.
Mm. And then in dogs, we always talk about the other therapies, like your hydrotherapy, your physiotherapy, your acupuncture, this kind of thing.
Yes.
What
So,
complex
I mean,
therapies should we be
yeah.
using for cats?
So this is a bit straying outside my expertise in that I have worked in clinics where hydrotherapy is used, and even in some cats. Not
Really?
very often, but yeah, some of the, not my patients, but actually, yeah,
Mm.
they a few of them that did tolerate it really well, and had
Mm.
had injuries for which it had been recommended, and sometimes even just treadmill therapy as well, actually, without the water.
Yeah.
Similarly, acupuncture is not something that I personally am qualified to do, but I would say it is often have to slightly take it with a pinch of salt, because it's not got published data, but often
No.
clients think works well. What we always have to be really careful about, and I'm sure this exists in dog world as well, but is the placebo effect, which
Mm.
is this impact that, when we're giving a treatment that we desperately want to be helpful to our pet, and we are asked as an owner, how do we think the treatment is working? There is this vulnerability that everyone has,
Yeah, of course.
that it's working, because we desperately want it to. And I think some of Duncan's studies in cats have shown the placebo effect, can be as high as 70%, as in people really,
Wow.
really thinking it's working, even when they're giving placebo. So
Yeah.
that does make these things a challenge. But nonetheless, I think if you have a cat with arthritis and you have an acupuncturist, there is absolutely nothing to be lost from giving it a go. And the
Mm.
feedback I've got from clients of mine who've wanted to pursue it, and I've referred them to colleagues who do the acupuncture, they've generally really felt it has been helpful. So
Yeah.
that is an option. And similarly, there, cold laser therapy is something else that
Yes.
some people use. Again, I don't have experience of that myself. I think there probably are other things that people have used as
Yeah.
well. I guess another aspect of veterinary care that's gathering some pace is the botanical therapies as well, and their
Okay.
usefulness in a range of things. So again, I don't have direct information or expertise, but I think that's out there.
It's
Probably
out
more
there.
familiar to me is some of the other elements that, again, you're using dogs, like diet and joint
Yeah.
supplements, which, again, on the cat side, we don't have so much evidence, and we do have more challenges. But
Mm.
I definitely do use those strategies as well. And there are some really good combined diets now for cats that have more than one medical challenge. So if your cat has got kidney disease and
Yes.
arthritis, there are some
Yeah.
good combination diets out there which helps as well.
Yeah. I think
And
even one of the weight loss ones has that in it as well, doesn't it? One of the ones where is it metabolic and joint disease? I don't know. I think
yes,
there's one as
yes,
well.
yeah, I think that's right. Yes, and there is actually, I think, still it's only one paper, but again, the fabulous Duncan Lascelles, many years ago, he actually did a study with one of the Royal Canin mobility diets,
Mm.
and the cats in the study were wearing accelerometers, so like a Fitbit type thing,
Okay.
and they actually monitored the cat's activity levels, and they did show that the cats receiving the special diet were more mobile, more active, took more
Okay.
steps a day. So there is a little bit of data to support those mobility diets. But I think a lot of individual variability as well, and also, of course, getting your cat to accept a specific diet
Yes.
is not always easy, but it is definitely something that I think is part of what can be
Mm.
discussed and what can be tried.
And with the supplements, would you go down the omega-3 supplements as we would with dogs?
And well, green lip mussel as well, I think
Mm.
is, again, I think there's much less data available for
Yes.
cats, sadly, and because of the palatability challenges as well, that's probably put people off doing
Mm.
some of those studies. But But yes, it's generally supporting, all the antioxidants and fatty acids that we hope are helping their joints, but also probably helping the cat's brains as well. So
Yes.
dementia, very common in elderly cats, and same
Yeah.
sorts of things that we hope will support that. So I don't think there's ever anything to be lost. But ultimately, for those really severely affected cats, it comes back to the painkillers ultimately, because all these other things can make an impact, but for the really badly affected cats, it's often not enough.
And this brings us on to this question that Bonnie wrote earlier on, actually, which is what things can be done early on to help prevent or lessen the severity of arthritis? So before you get to that point where you need the painkillers, maybe.
Well, that's a brilliant question. And I'm not sure at the moment that we have got tools to tackle that. Nutritional products that I know are marketed for arthritic cats, but are really better when, before the damage has happened. So maybe,
Yeah.
um, I think, there's no evidence for this that I'm aware of, but maybe something that you could do would be to feed a senior orientated diet to your cat.
Right.
Rather than waiting for any clinical signs, when the cat reaches the age of 10 or 11, try and feed the best quality diet that you can, that is one that has got these sorts of supplements in it, that is supporting those slightly more fragile joints, possibly even maybe joint supplements at an earlier age. But the issues we run into often are acceptance, and I'm sure I know people are working on these things, but I think at the moment we don't have a clear idea
Answer.
of what you can do. Yeah.
But I guess the one thing you can always do is keep them lean, make sure they're not overweight. So you can do that
Yes,
throughout.
definitely. And
Definitely help.
it is so easy, unfortunately, to actually make a cat weight in the same way as I'm sure with dogs as well. So I'm a big advocate for actually really being quite strict with the food you weigh. If you're using dry
Yeah.
food, weighing out what you feed. If you're using wet food, obviously know exactly how many grams that you're putting out. And bear in mind that a lot of the guidelines on the packets that say 4 kilo cat needs certain grams, they tend to be very sort of over enthusiastic
Generous.
in my experience,
Yeah.
very generous. Yes.
Yeah.
So feed to body condition, and nip it
Yes.
in the bud. So if you have older cats in particular, I would also say, or if multiple cats in particular, I would say it's also worth investing in some scales so you can weigh your cat at home, because it's very difficult actually monitoring weight in cats. And often, actually, as vets, you'll have seen this a lot, I know, Nikki, but we see cats that have lost a lot of weight, and the owner hasn't noticed, not because they're a bad owner, but just it's very
No.
difficult when you live with that cat every day to
Yeah, you
see
just don't
that very,
notice.
very gentle weight loss. And it's quite basic but good scales that were probably originally designed for babies. But if you Google cat scales, you will find them for maybe 20 to 40 pounds, so not break the
Yeah.
bank amount of money. And then even just weighing your cat, if it's an older cat, I'd say weigh it once a month, just plonk it on the scales. And what we're looking for is obviously a nice steady weight. Any weight
Yes.
loss, unless you've been trying to diet your cat, any weight loss should not be ignored, even if your
No.
cat was fat and is getting thinner. If you're not doing something to cause that, it's something you
Yeah.
should speak to your vet about.
Because the sooner you get on top of these problems, the sooner you can stop them or at least manage them.
Yes.
Just a couple here. This is from Nicola saying, my cat was having acupuncture but started to not be able to tolerate the needles. I'm wondering if that's because her pain was increased as the OA symptoms had increased. I don't know if she was also on pain relief at the same time, Nicola, but if she wasn't, it might be worth trying again when she's on the pain relief. Or yeah, it could be that she's more painful or just annoyed because they're not very nice needles.
It's amazing how a lot of cats do tolerate it, though. I always think looking at the needles, I just in amazement.
I've done it on a couple of cats, and I often get the needles in okay, and then when you have to get them out,
Oh,
it's a little
really?
bit That's the scariest part, because
Okay.
they're just a little bit annoyed after sort of 5-10 minutes of having them in, and then so I don't choose to do it a lot in there. Nikita's just written here as well, what do you guys think is the greatest reason why there's so little research done towards felines compared to canines? Money?
Yes, I think, unfortunately, something I've been told my entire career as a feline-only clinician is that cat-only practices don't make enough money, because probably because of the way that we've structured our business models, in that traditionally vet clinics have obviously put markup on medicines, and if you've got a big animal, it needs a lot more medicine than a little animal. But yes, certainly throughout my career I've been told, yes, you can't have cat-only practices because they're not financially viable, which is obviously not true, because there are now,
Many of them
thankfully, quite a lot of cat-only practices.
Yes.
But I think that probably is it. And so from a pharmaceutical and pet food company as well, they often are seen as less important, even though, about half of the pets are cats. So they're obviously very important.
It's getting there, but it will never be the same as it is in the dogs. Marianne's just written, I think people cannot access these. The videos of the steps in the consult room, can they get to that via your website?
So they will be, I'm sure, featured in some of the webinars. And if anyone who is working in a vet practice and is interested, I have got a chart with the dimensions of the steps that were used in the room. So if anyone wants to build any, then if you just go through the contact button on my website, it's probably the easiest thing, and I'll happily share that with you.
Perfect. So I'm going to call it a day, because I've just realised we're here for an hour, and also I don't want your voice to go anymore.
Delighted it survived.
No, thank you so much. I was thinking, oh gosh, you're getting a little bit, I don't want you to get too croaky. Thank you everyone for your questions. If you do have any more, please put them down, and I will attempt to answer them, or ask Sarah if it's something that I really don't know about. But arthritis is so important in cats. Like say, sort of 90% of them are going to get it, and living in pain is not fun, and we're aware, and we should be looking for it, doing better. So if you think there's a problem, ask them, demand that they start looking and paying attention to you. Thank you very much. And we will see you. And I think we've got one more cat live this month. So do join us. Everyone's saying thank you so much. Thank you so much. And I will put all the links to everything in the blurby bit of the Facebook Live afterwards. So have a good night, everyone. Thank you so much, Sarah.
Pleasure. Take care, everyone.